Hello, and welcome to one of our 11 Together to Goal Campaign Plank Mentor webcasts. Today, we'll be hearing from Dr. Liana Spano-Brennan of the Summit Medical Group. Dr. Spano-Brennan is the Plank Mentor for the Assess and Address Risk of Cardiovascular Disease Campaign Plank. Dr. Spano-Brennan, thank you so much for joining us today.
Oh, thank you so much for having me.
Great, let's get started. Why don't you tell us a little bit about you and your organization?
Sure. My name is Liana Spano-Brennan. I'm a cardiologist. I've been in practice for about 8 years, 3 of which have been spent with Summit Medical Group. Summit Medical Group was established in 1929. It's a very large multi-specialty practice in New Jersey, covering over 7 counties and with 900 providers. We care for over 500,000 patients in the New Jersey area. I have been practicing in Summit Medical Group for 3 years with a special interest in primary and secondary prevention of coronary disease. I have also developed an interest in treating women and prevention of heart disease in women. I've also become interested over the last few years in cardio-oncology, which is a special interest of mine as well.
Great. In your role on the diabetes care team, what tools do you use to assess a patient's risk of cardiovascular disease?
So I've had the pleasure of working with some wonderful people on the diabetes care team in Summit Medical Group, and in acting as the cardiovascular advisor for the Together to Goal cohort for CVD innovator track, I've had the pleasure of working with multiple people in the AMGA community. In our efforts to assess and address cardiovascular disease in our own practice, in our own group, we have developed different tools to educate patients and providers, one of which is use of the ASCVD risk calculator, which many of you have already tried to incorporate into your EHRs or into your practice to identify patients at high risk, and then to educate providers and patients in treating those patients who are at high risk. I personally like to use the aspirin tool, which is an aspirin guide put out by Brigham, which also helps to discuss and bring up the caveats of aspirin use for both primary and secondary prevention of cardiovascular disease. In working with the diabetes care team in our own organization, we've also developed lipid guidelines and incorporation of aspirin guidelines into our diabetes treatment algorithms, which has helped providers.
Wonderful. Talk a little bit about the considerations you make when determining a treatment plan for a patient with an increased risk of cardiovascular disease.
I think when you're talking to patients with cardiovascular disease or who are at high risk for cardiovascular disease, especially diabetics, it's important to empower the patient, educate the patient, give them the tools they need to come up with their own decisions. So what I've done is really open up the calculator on my desktop, show the patient what their risk is, play around with the numbers to try to prove to them their risk and what happens with therapy, statistically to reduce their risk. I've used tools such as the ASCVD risk to empower the patients who then look at those numbers and become interested in how they can reduce it on their own. One kind of a trick or method that I use is starting low, gaining trust. So if a patient is kind of hesitant or skeptical of the use of statins or aspirin or some other either maybe blood pressure medications, and I can convince them that even a little bit goes a long way and they see the improvements in their blood pressure or their cholesterol, then they can become compliant with the medication even at low doses and escalate as needed. So I found that tactic or method works for me and helps to gain trust in the patients.
Great. And what is your feedback loop to the rest of the care team?
So personally, my care team in my own practice, it consists of a nurse and a medical assistant who help work with me and review my laboratory studies. And then there's a feedback loop with getting results to patients, encouraging them to be compliant, making sure they're compliant, and then having them follow up to make sure they get repeat labs and repeat visits. The diabetes care team for the organization is also doing the same thing on a larger scale for the endocrinologist team, and they're reaching out to patients who are non-compliant or have not demonstrated return visits if their A1C is elevated or if their blood pressure has been elevated. And that's been a nice tool in getting patients back into the system to improve outcomes.
Great. So do you have any advice for groups that are looking to integrate a cardiologist into their accountable diabetes team?
Well, as many of us know, the leading cause of death for diabetic patients is cardiovascular disease, and it's estimated to incur costs of over $250 billion per year. Because of that, I think it's important that we all keep cardiovascular disease and treatment of risk factors in mind when we're treating diabetic patients. Having had the pleasure of working with different administrators, nurses, pharmacists, internal medicine doctors, I have a different perspective on what treatment for diabetes means. And I think that from being on those teams as a cardiologist, I've also been able to give some perspective of my own. And I think every part of the team helps the other to understand what our end goal is. So I do think that multiple specialties and multiple clinicians are useful in coming together and treating these patients.
Wonderful, Dr. Spano-Brennan. Thank you so much for being here today and sharing your expertise with other Together to Goal campaign participants.
Thank you so much for having me.
As a reminder to fellow participants, if you'd like to contact Dr. Spano-Brennan to discuss implementation of the Assess and Address Risk of Cardiovascular Disease campaign plank at your organization, email t2gmentor@amga.org. Also, check out our remaining Together to Goal Plank Mentor webcasts at togethertogoal.org/Plank Mentor to discover what other experts have done to improve diabetes care across the country.